Now we're going to hand us over to Kevin Wren and to Pat Cashman.
And I am pleased and elated to welcome the hilarious Pat Cashman from Almost Live fame to help lead our paddle call today.
Kevin, thank you. Thank you very much. It's a pleasure to work with you and a pleasure for me to be here as a part of today's big event for HCFA. You know, the best advice I ever got in my employment, and I'll never forget the words of the general manager who told me, Pat, clean out your desk, you're done here. And that was bad enough, but it was also bad that I then lost health care for a period of time. Kevin, as you said that about rationing, is that something you actually did where you had to say, I don't know what level of insulin you take?
It's happened numerous times in my life just because, I mean, insurance is tied to employment, and graduating into the recession in 2008, I was underemployed and underinsured and was rationing insulin. My father, fortunately, is a diabetic, so I was able to glean from his stash, but it happened again in 2013 when I was laid off from my job at Microsoft and couldn't afford my COBRA payments. Fortunately, the ACA came through and I was able to afford my medicine and didn't have to ration. But even, 6 months ago, when I went to the pharmacy and my doctor switched the prescription, so all of a sudden insurance wouldn't cover and it was more than my rent.
More affordable health coverage for Washington residents. It's so critically important. And this, of course, is something that we believe the rest of the country is going to emulate. But it's got to start somewhere. And this state, this Washington state, as I mentioned at the get-go, they've never been kind of taken up the rear. They've always been a leader. Why not be a leader in this critically important proposition for everybody that lives in this state?